Jeremiah and I have been seeing each other on Slack for a while, but this is actually the first time I've seen him after about what, a month or two of running into each other on this COVID tracking project Slack. And I'm so glad you could join us.
You bet.
So I work at Observable. I've been here since January, which feels like either not that long or forever. Do you want to talk a little about yourself? So you and I ran into each other because we both started volunteering for this COVID tracking project, Slack, which I'll show some of that in a moment. But do you want to just describe you just moved?
Sure. Yeah, I just moved this week, so that was a fun layer of stress to COVID. But regardless, I'm happy now in sunny Sacramento, California. I'm a data journalist. I most recently worked at NBC News, mostly covering political stuff, so election results and campaign finance, but really anything with data and graphics. And before that, I was in like the quote unquote civic tech space or open government space, depending on what you want to call it. I worked at 18F building graphics and interactive dashboards for different government data sets. And I've been an Observable fan since, I think it was called D3 Express, right? When Mike first talked about it at CSVConf a long time ago. I didn't get it then, and now I'm like, oh man, this thing is so freaking cool. And yeah, like you said, we're both on the COVID tracking project, which is an all-volunteer project that unfortunately exists in this country because we don't have an authoritative good time series data set from the federal government. And we've been working together just trying to make this data a little bit more intelligible, accessible, less scary, dare I say. Yeah.
So I wanted to share, the way I first learned that you had moved was this post you did, what is this, last week, including a chart you made in Observable of your city bike patterns in New York.
Yeah, this was a fun little like farewell to New York data viz that I did.
So it was nice to see that. Didn't even...
I mean, I kind of just talk a little bit about why I did this on
please.
Observable really fast. So one thing I think is so freaking cool about Observable is it's like this graphics production place, but also this publishing platform. And what I've been doing a lot of is using Jeremy's input library so that I can quickly, just kind of like Vlad was showing, when you code with a constant, but then you change it to an input, you can adjust it and make your graphics how you want. And I've been doing a very similar thing. But it's just so great to be able to do all that and then click on the little three buttons and say download it as PNG and share on Twitter. So that was really, really awesome. I've been doing that quite a bit actually recently.
Love it. So, so when I first saw the COVID tracking project show up on Twitter, when you went to covidtracking.com, all you got was this spreadsheet. It started out by a couple of journalists at The Atlantic, Alexis Madrigal and Rob Meyer, and Alexis's old college friend, Jeff Hammerbacher. And they started methodically going through the various state-by-state data dashboards, each of which was in a different format in a different place, and collecting in one place for easier access the data that the CDC was not effectively capturing. And it's been incredible to watch. I have been only barely involved, and Jeremiah has been much more heavily involved, but it's been amazing to watch the growth of this. I just want to scroll through the history of the Twitter account so you can get a sense for it. Here in the first tweet, March 8th, the number of people tested crossed 3,000. And over the course of
ages ago.
Yeah. Do you want to tell us a little about how you first got involved?
Sure. There's a data journalist Slack that I'm a part of called the News Nerdery Slack, and they reached out. So this project is all volunteer driven, and they just wanted some help interfacing with newsrooms, making sure that people were available to answer data journalist questions, and then also take some of this data and make some of the charts that make it a little more intelligible. Toph and I were talking last night how this crisis is interesting in a lot of ways, but one thing that's interesting to me is that it's entirely chart. Our understanding is entirely chart based, even down to the metaphors we're using. Flatten the curve is a graphical phrase. It makes no sense if you don't see the chart to go along with it. So we just wanted to get a couple people on the project, kind of harness some of the tremendous volunteer energy of people who are stuck in their homes and want to do something that aids their comprehension or their neighbor's comprehension of the crisis. And it's just been overwhelming how many people have joined, actually, including you.
It's remarkable. You can sort of see in the Twitter feed the evolution of the visual storytelling, where it starts out incredibly sort of scrappy and pragmatic and screenshots of that Google spreadsheet. And then over time, it has grown to this whole very professional, polished thing with an extensive visualization guide, including this comparison of how many more of the tests being done the COVID tracking project has captured than the CDC, which speaks to the importance of the volunteer effort. And there are a lot of maps here and charts. And then the thing that that I have found so valuable is that there's also this excellent API. So on top of the spreadsheet, there is now an API which is upstream of who knows how many efforts to visualize this, including a notebook that you made that I wanted to show, which is quite this. So this, do you want to describe this?
So Observable, like I said before, has become just my de facto production tool for a whole bunch of different cases. There's a case with my blog post where I'm just downloading an image, but then there's this really just killer use case of making something for a semi-technical person to be able to manipulate a little bit of data to get a graphic. And so we started doing this. As you can see, as you're typing, just the observable magic is working, and you add some different fields. You can download that image as we did before. And the goal here is to leverage the API and make it as easy as possible for any of our social team or the people making tweets or writing blog posts, or even those of us just looking through the data on the project to make sure it's all right, to easily add a chart or download a chart and keep it all looking professional. I mean, we wanted part of the project, the entirety of the project is about trust. This is a trusted data source. And so while Google Chart graphics definitely work, it's a little nicer to have this kind of daily update. If I can share my screen. Cool, so this is the website that Toph was just showing, but if you come down into the Twitter and you don't go all the way back, but you just even go till yesterday, we publish this kind of chart every day. They're usually around the daily tasks completed. That's one of the biggest things that people who are all watching. But this chart is just generated from that observable notebook. And then whoever posted this to Twitter was able to just add their own caption, add their own title. And we've done that a couple times. Can I show the other notebooks?
You bet, please do.
So this is the notebook.
Go ahead.
Yeah. So this is the notebook that Toph just showed. The idea is that for using the API, so to match our charts to our data, just like any other downstream consumer might, and you can easily choose whatever region of the country or state you want and get the chart for Twitter. I have to say it's really nice only making like static charts for Twitter in a 2:1 aspect ratio instead of being concerned about responsiveness of the chart.
Constraints are very powerful.
Constraints are powerful. Good design features. But then, this is a thing we were doing a lot, especially a couple of weeks ago when New York was kind of the focus point of the outbreak in this country or in the United States, is comparing one region or one state. I use the word region because we also talk about the US territories and DC. One region compared to the national. So you could see right around when we were really using this chart pretty heavily, this is the daily deaths, which is a pretty morbid subject, and these numbers are really big. But you can see that New York was accounting for a significant portion of the national death toll and has tapered out. And this isn't the curve that we're trying to bend because this is a death curve, but I guess it's one of them. You can see here just how much of our understanding is based on these charts and not just the data itself. So we have this chart type that we can help our friends on the social team make. And then we have this other idea, now that we're weeks, dare I say months into this crisis unfolding, we're all learning about new types of metrics and derivative metrics and things we can use to better understand the crisis. And this is based on an article written by the project founder, Alexis Madrigal, around the positivity rate, which is, or the positive rate, which is the positive test rate. And it's a way of kind of getting around some of the per capita concerns and better understanding the situation on the ground. I think.
So can you define the positivity rate?
Yeah, I can. I can actually just show you the observable function.
Oh, amazing.
It's defined. So we take the total number of positives and the total test results. So those will be cumulative based on the way that this data comes from the API, and we calculate that on a daily basis. So the cumulative positive rate is the number of tests that are positive over the total number of tests.
Mm-hmm. So for someone watching this, if the positivity rate is extremely high, then is that an indication that we're under testing?
Yes, it generally is. So in Alexis's piece, he has this metric of 10%. Above 10% positivity or positive rate is cause for concern. New York has been a cause for concern for the entire outbreak here, so you can see. But one thing you'll see a lot happen in these charts, I should have picked a good state. You can see stuff like this, where you see massive ramp-ups in testing.
Mm-hmm.
And sometimes it'll also highlight a lot of the other things that's been a problem with this crisis is the data quality. So data coming out of these states, in a lot of these states, when you go back all the way to the beginning of March, you'll notice they might have a positive rate of 100% or 90%.
Mm-hmm.
And obviously there's not 100% of the population affected, and that might not even indicate that there's a big outbreak there. It's just an indication that the testing regime is nowhere near adequate. So it's kind of this really interesting metric we can use.
Total test results is in the denominator. So a massive ramp up in testing corresponds to this chart going down, right?
Right. Well, it depends. You might see, right?
Yeah.
Because if you're a state where you're only administering tests to sick people, then those numbers might climb together and you might get a spike. But let's look at New York, just because they have a very widely deployed test regime, so we can better understand this curve. You can see that around March 15th, we start to get a nicer curve where we're actually seeing this bend down a little bit. I mean, it's it's maxing out above 40%, which is extremely, extremely high, extremely concerning. But yeah, so generally when I look at these charts, I want to start after the beginning of the crisis when I have an understanding when the state started doing good data. But what we can see here is that there was a bunch of positive tests in New York, and those have started to come down, even though the total number of tests, which I'll just quickly do right here, has continued to mostly go up.
Yesterday, we were talking about the sort of quantitative literacy of a lot of people following this story closely, where there's no single metric that is the canonical authoritative way to track the crisis. And if you look at the replies to the COVID tracking project on Twitter, a lot of times people are scared or upset or concerned that a certain kind of thing isn't being counted, or how do you think about those decisions?
So as a data journalist, I find that this is always the situation. When there's a story about something that to me feels a lot more trivial than COVID, something like a Dow reaching a high, or a low, I guess. Well, that's one metric, and it's not that interesting. Most data stories that are about complicated human dynamics have at least one metric, if not a handful. And so I think it's actually been really great because we get that feedback and people say, like, I would like to see these other things, and we agree. and newsrooms agree too. There's lots of different charts and creative work going into making those things more accessible and easier to read. The reality is that collecting data like this is super difficult. You know, the world rejects strict categorization as much as those of us who work with data would love for it to not do so. And so, you know, even things like when in California, where I now live, when the cruise ship came into the port and there were passengers not from California, where did those numbers count for? I know there was an issue with that in Maryland too. Also, you know, we know that deaths are unfortunately being dramatically undercounted just because we don't test every person who is dying during this time for the virus. So I think that's all great. I like that because I just totally dislike this notion that data doesn't lie. I think data always has a viewpoint and a frame, and it's super helpful to make that clear, especially in with such an important data set like a virus that shuts down the entire world.
Mm-hmm. Many years ago, when I worked in a newsroom, my friend, a fellow data journalist, said to me, "I don't think anyone has ever made a data-driven decision," which I think is a sort of common lament in people who work in this, or it's, I don't know, you know, maybe it's not necessarily a lament. It's also just a recognition that that decisions have to be messier than that. But it's been, how do you think about what sort of decisions do you see people making either in government or in the population in response to the data journalism being done?
So I do, well, first of all, just to go back to this, like the fact that flatten the curve or, you know, whatever invective the curve you're going to do is so popular is just an indication of this, because now we are, you know, I was talking with my in-laws yesterday about how frustrating social distancing is, but that using this data, we can see the effects and how they're positive in regions that are taking this seriously. But I think it's better because it's like a metadata story. It's kind of like, oh, well, the government should provide this really reliable data, and why isn't it doing that? One of the things that the COVID tracking project has been doing, I'll share my screen one more time. Oh, I'm still sharing. Is if you come to our data, you'll notice that each state has a quality grade. And this does not mean necessarily that like their data is terrible. Our grading metric is actually pretty, can't find it, pretty intense. There are 16 different categories that the project is measuring each state on. And this is a reflection of exactly what you're saying. Like there are maybe not any data-driven decisions that we can really make on a personal level using this data, but what we can make decisions about is that our government should be collecting data that helps us make these kinds of decisions, and that if they don't, that it sets us all at a disadvantage, that the people in power can't make appropriate decisions, and those of us who aren't in power necessarily can't make decisions that impact our lives. For instance, like I think the demographic information is something that's come out in the last week, and that's super hard to collect from all the states, but super important so that we can make sure that health resources are at least nominally and hopefully practically being delivered, you know, with respect to where they're needed and with respect to communities that might not get them otherwise.
Well, thank you so much, Jeremiah. You are wise and diligent, and I'm glad that we have you working on this. That's
really nice. That's going to be my new Twitter bio.
I mean it. I mean it. We have some questions in Q&A. Let's see. What was that data journalist Slack workspace name? That was
it's called the News Nerdery Slack. It's an invite Slack, but it's pretty open.
How can people volunteer and help?
That's a great question. One thing that I think would be great is if you just use our API, make an observable notebook, and tweet it at us. We have lots of people helping. That doesn't mean we have too many people helping, but I think the biggest thing that I would like to see more of is responsible experimentation. So you don't need to have a ironclad methodology to produce a chart on Observable if you just say it's a work in progress and I'm exploring this topic. One thing I used to love doing in the newsroom with Observable is like for campaign finance data, making it so that you could easily, a reporter could easily look at different things together without having to code. And so just click a checkbox and see a new data set or something like that. So I'd love to see people use the COVID tracking project data and mash it up more with census data. I haven't seen that much data visualization of it, comparing it to income brackets or any sort of economic demographic data that we have. We know that poverty in the United States is a problem, and poverty is a pre-existing condition for a lot of problems. So I would love to see more stuff like that. If you have anything, share it with us at COVID-19 tracking or at Jeremiah K, either one. I would love to see it.
So would we. And there's a coronavirus observable collection that includes some of the things people are doing, which we can post.
Including a really great cartogram that you did. If folks haven't
thank you.
That. Yeah.
Let's see. Who is involved in curating this data? Asks Mark McClure.
Good question. So one of the most valuable aspects of the COVID tracking project is that it's human audited data. So there's a team of volunteers that every day, multiple times a day, go to these sites, the state sites, if not the state, the most authoritative site for that state, and pull that data and reconcile the messiness. You know, you see spikes. This has been a widely reported. You see spikes over weekends because data kind of gets bunched up in the bureaucratic pipeline and then comes out on Monday or something like that. And so the data we have is only as good as the states can have. And so we should all ask our governments to provide high quality data. Otherwise, you know, we're all flying blind, so to speak.
Which leads us into Tom White's question, which is, have the states improved their reporting over time?
Tons. So, I'm just learning about all this fun new version history stuff in Observable. So this might not work at all, but one of the first notebooks I did for this project was experimenting with the positive, like who's reporting different aspects of the data. And so in the beginning of this project, these two charts were not white. They were heavily purple, which means that many states were not reporting certain things. It also reflects that many states are now not reporting pending results, which is actually an improvement. Pending is a very confusing, ambiguous category. It's hard to reconcile. And so I wish I had kind of taken a screenshot of this thing every day and we could see the maps change. But the reality is that the states have gotten significantly better. The federal government has also gotten better. But given that this project exists, they haven't done enough.
Philippe asks, why are the notebooks shared and not published?
I don't know, because I was scared. There's no good reason. They're internal tools, and so I just figured, you know, it's great if people have the links. Obviously, you can reverse engineer a graphic and make a COVID tracking project style graphic with the logo and tweet it from your own account. And, you know, we can't do anything about that. So I don't know. I don't have a good answer.
It is striking to me when I look at and share my screen looking at one of your notebooks versus when you share one of your notebooks. I think we get some sense of the role of the implicit process knowledge of having done the job day in, day out for the last couple months. I think the COVID tracking project has been incredibly diligent about providing guidelines for people to use this data responsibly and making sure to have, you know, the caveats in the footer that the number of positive test results is not the number of people who have the virus and that sort of thing.
And it's only going to get more confusing as you think about what it means to reopen a country and the fact that a single test is just a point in time snapshot. And as we have more complicated interactions and hopefully a reopening of the economy at some point when it's safe, those numbers, one test does not equal one person anymore. So we're going to have to think about all new ways of showing this kind of data.
It's been amazing to watch how much the COVID tracking project has expanded the purview of the sort of data it's collecting and the way it's presenting it. it's a strange, grim topic in that it's like it's the reason we're all in little boxes on a screen here. We had a lovely in-person meetup in the office in San Francisco in like early mid-February, and hope we can have that again sometime, and maybe one day we can meet.
Yeah, that'd be great. Thanks for all you're doing. Maybe I'll go just from that comment and go make a few more of my notebooks public, but I've just been really liking the tool. Basically, anytime I have a sketch of an idea, there's an observable notebook, usually half finished at this point, trying to explore it.
Thank you so much, Jeremiah.